North Korea often touts its provision of free healthcare, education, and housing as a fundamental right, a claim that might astonish many in the Western world, where even the most developed nations, including the United States, struggle to offer such comprehensive benefits. Today, let's delve into the reality behind these political assertions. Firstly, while free housing does exist, it is not available to everyone. It requires significant contributions to society, meaning it's largely irrelevant for average North Koreans. In fact, real estate transactions have become common in North Korea, and when comparing incomes to housing prices, the cost in major cities is equivalent to those in developed countries. These prices are unaffordable for average North Koreans throughout their lifetime. It's worth noting that before 1990, almost everyone had access to free housing, supported by aid from the Soviet Union and China, resulting in a higher standard of living than other communist countries at the time. However, this standard was not due to North Korea's own economic strength and became apparent after 1990. Regarding free healthcare, North Korea does provide it, but its healthcare system faces several severe issues. First, medical resources are extremely scarce. Most hospitals lack equipment, and even basic medicines are in short supply. Supplies donated by the United Nations are not distributed to those in need but are somehow sold directly on the market. This results in minor illnesses going untreated and severe diseases also being neglected. A few years ago, when the World Health Organization visited North Korea, there were hardly any basic medical supplies. They were just administering infusions to the destitute, but the quality of these infusions was poor. Some medicaments, long abandoned by other countries, are still used in North Korea. Furthermore, the training system for doctors is relatively backward. Medical students spend much of their time laboring and have little time for studying. Additionally, the educational system is problematic, so very few qualified doctors graduate each year. Lastly, regarding free education, basic education in North Korea is almost entirely free, but textbooks are charged for, and various fees are required. Therefore, it's challenging for children from ordinary, especially rural, families to even complete high school. This results in a significant bias in the proportion of university students toward children from Pyongyang and other large cities. Although there are no official tuition fees for higher education, there are many hidden costs, and students must cover their own living expenses. Under these circumstances, it's a substantial burden for most ordinary families to support a university student who leaves the workforce to study in the city. Only if the student is admitted to North Korea's premier institution, Kim Il-sung University, are all costs for room and board covered, but most spots are reserved for students from powerful backgrounds, not those who have strived on their own merit from ordinary families. More importantly, with North Korea's stagnant economy, there are few suitable job opportunities for new graduates, which keeps the number of people in higher education low. The so-called free education is merely a literacy class, mass-producing labor that aligns with the values of the Kim family. Both publicly available information and testimonies from North Korea escapees indicate that North Koreans are struggling on the brink of starvation, with deaths from hunger common in rural areas. When people can't even eat to satiety, any free education or healthcare is meaningless. All the free offerings are mere empty concepts. It's absurd to imagine educating someone in a classroom when they are starving. Thus, it's clear that much of the free in North Korea is taken out of context and is merely an empty, false concept. Would you appreciate such free housing, healthcare, and education?